Muy buenos días y bienvenidos al webinar de la Organización
Good
Panamericana de la
morning
Salud
and
para
welcome
conmemorar
to
el Día Mundial de
the
la
webinar on
Diabetes.
PAHO's World
Buenos días, soy
Diabetes
Silvana
Day.
Luciani del Programa
My
de
name is Silvana
Enfermedades No
Luciani.
Transmisibles de
I
la
am
OPS en Washington,
from
D.C.
the
Y hoy día
Department on
tenemos
Non-Communicable
un gran
Diseases
programa en
on
inglés y en
Washington, D.C. We
español y
have
tenemos
an agenda
traducción
in English and
simultánea,
Spanish, and we
como
have
entenderán de aquí a
simultaneous
un momento.
translation or
Good morning
interpreting.
and welcome to the PAHO webinar commemorating World Diabetes Day. I'm Silvana Luciani from the NCD program at PAHO in Washington, D.C. We have a very exciting program for you today in English and in Spanish, and you just need to select the language of your choice in the Zoom platform. So thank you. Y estamos muy emocionadas de tener este
We
webinar
are
hoy día
super
para llamar
excited
la
to have this
atención
webinar today
hacia
to bring
la
attention
diabetes como un problema de
to
salud pública.
diabetes
Pero
as a public
estamos
health
también
problem,
sobre los
but
desafíos y
we
todas las
want to discuss
oportunidades en el sistema
challenges
de salud
and
para
all
mejorar
opportunities in the
tipos de
region to
tratamiento y
improve
control.
diagnosis,
Y lo que nos
treatment, and
motiva
control
también hoy
or
día es que
monitoring.
hemos
What
desarrollado nuevos
motivates us
recursos desde
today
la
is that we
OPS
have
para
developed new
mejorar el
courses
manejo de la
from
diabetes,
PAHO to
incluyendo un
work
nuevo curso
on
virtual.
diabetes
También tenemos
management,
nuevos
including a
medicamentos y
virtual classroom.
tecnologías en
We have new
nuestro fondo
medicines and
estratégico
new
de emergencia
technologies
que
in
vamos a
our
lanzar hoy
strategic
día. Así que
revolving
tenemos
fund.
un excelente
And
programa, muy
we have an
interesante.
excellent
Gracias por
program, which is
acompañarnos
quite
hoy día.
interesting. And
Y
thank you
para
for joining
empezar
us today.
y darnos palabras de
To
bienvenida,
start
voy
and
a
give us some
introducir a
welcoming
Dr. Ansel
words, I'm
Hennes,
going
el
to
director
introduce
del
Dr.
Departamento
Ansel
de
Hennes.
Enfermedades
He
No
is
Transmisibles y Salud
the
Mental.
director
Dr.
of the
Hennes.
Department on
Thanks, Ms.
Non-Communicable
Silvana. Good
Diseases
morning.
and Mental
Good
Health.
morning to all. It's my great pleasure to welcome you to this webinar from PAHO in commemoration of World Diabetes Day. We are all too aware that diabetes is a significant public health issue, a major cause of ill health, disability, and premature death globally. In the Americas alone, an estimated 62 million people are living with diabetes, mainly type 2 diabetes, and over 340,000 people die annually from diabetes and related complications. The number of people with diabetes is rising rapidly in our region, driven largely by obesity. Sadly, the region of the Americas has the highest rates of obesity worldwide, with over 33% of adults having a BMI of greater than 30 kilograms per meter squared, which is the cut point for obesity. Unfortunately, underdiagnosis and undertreatment of diabetes continues to be a major challenge, largely due to the weak health systems and limited access to services. In fact, an estimated 40% of people with type 2 diabetes do not know they have the disease. And the global estimates on treatment coverage reveal that more than half of people with diabetes, of the more than half people with diabetes, roughly 60%, did not receive adequate treatment in 2022. Therefore, it is imperative that we work together to improve access to primary health care, including essential diabetes medicines and technologies, to improve diagnosis, treatment, and self-management of diabetes. This is essential for diabetes control, to prevent its complications, and to lengthen and improve the quality of life of people living with diabetes. Insulin and other essential diabetes medicines must remain accessible and affordable to those who need them. And in this regard, I want to urge governments to make better use of the Pan American Health Organization Strategic Fund, which offers high-quality diabetes medications for a unique price, regardless of the purchase size. Our health professionals must ensure that people with diabetes understand their risk and have access to information and tools to manage their disease. And those living with diabetes must remain in control of their disease by remaining active, eating healthy diets, and monitoring their conditions. To support these actions, PAHO is providing technical cooperation to member states and working with our partners in the World Diabetes Foundation to strengthen primary care services for diabetes and increasing capacity of primary care providers to diagnose and treat people with diabetes. In this regard, I'm pleased that in today's webinar, we will launch PAHO's new virtual public health course on diabetes, as well as illustrate the suite of diabetes medicines and technologies that are available in the Strategic Fund. We hope that the information shared today during the webinar will help to prioritize efforts for the prevention, control, and management of diabetes. I hope that you all enjoy this webinar and find it valuable and helpful. I also hope that all of you leave this session motivated and committed to strengthening the response to diabetes in any capacity or role that you can play. So welcome. We look forward to your full participation, your contributions, and to accompany us on this journey as we work to improve the well-being of all of diabetes and the prevention and control. Thank you so much.
Thank you. Thank you very much, Dr. Anselm Hennis, the Director of the Department of Non-Communicable Diseases and Mental Health here at PAHO in Washington, D.C. Thank you for reminding us of the burden of diabetes, but also the big problem that we have with underdiagnosis and undertreatment, and the call to action to help us work to improve diagnosis, treatment rates, and ultimately control rates to prevent premature death and complications from diabetes. So thank you, Dr. Hennis. Y muy bienvenidos a todos los que están
Welcome
conectados de
everyone
Panamá,
connecting
Bolivia,
from
Paraguay,
Panama,
Colombia,
Bolivia,
Brasil.
Paraguay,
Estamos muy
Colombia,
emocionados de
Brazil. We are super
tenerlos
excited
aquí con
to
nosotros
have
hoy
you
día.
here with us
Así que
today.
seguimos con el programa
We are going to
y
continue
tenemos
with
una
our program.
presentación sobre la
We actually
situación de
have
diabetes en
a
las Américas
presentation
y
on
los
diabetes
nuevos recursos
situation in
de la OMS.
Americas and the
Y
new
con la
resources
doctora
from
Carmen
PAHO. I would like
Endine,
to
quien es la
invite
asesora para la
Carmen
prevención y
Endini.
control de
She's advisor
diabetes
for
aquí en la
prevention and
OMS
control
en
of diabetes
Washington. Muy bienvenida,
of
Carmen.
PAHO
Adelante.
in Washington.
Gracias, Silvana.
Welcome,
Muchas
Carmen.
gracias.
Thank you,
Lo
Silvana.
primero quiero dar la
And
bienvenida a
I
todos
would like
nuestros
to
colegas. Tal como tú
welcome
mencionabas, tenemos
our
mucha gente
colleagues.
conectada de distintas
We have
partes de
lots
nuestra
of
región,
people
lo cual siempre
coming from
es
different areas of
gratificante.
our region, actually.
Y antes de comenzar a hablar, porque
And
es más bien una
before
conversación,
saying
no es
anything,
una
because this is a
presentación
conversation,
académica,
this is not an
creo que para
academic
iniciar la
presentation.
conversación vale
So
la
to
pena
start with this
recordar por qué
debate,
estamos acá.
we should
Estamos acá
remember
porque
why we are
estamos
here. We are here
intentando mejorar la calidad
because
de vida
we
de
are
las
trying to
personas que viven
improve
con diabetes.
um,
Pero también es
quality
bueno
of life
recordar
of
el
people with
simbolismo
diabetes. But it is
del Día
important to
Mundial
remember
de
what it
Diabetes.
means to
Si
have a
ustedes
World
se fijan,
Diabetes
no es
Day.
casualidad, mi
If you
pantalla está
notice,
puesta en azul ahora. El
my
símbolo de la
my
diabetes es un
screen is
círculo
blue,
azul. Y
and
no es
the
casualidad. El
icon
círculo
of diabetes
simboliza
is
el
a blue
positivismo,
icon,
la unidad
and
y la
this
fortaleza, que
represents
son tres
positivity,
características
unity,
que nosotros
strength.
debemos
These are
desarrollar
three
cuando trabajamos
characteristics
en
that we should
diabetes.
develop when
Y
we're
el
working
color es
with
azul
diabetes.
porque es el cielo que
And the
todo nos
color is
cubre.
blue because
Todos
basically
estamos
it's the
bajo el mismo
sky.
cielo y
We
todos
are
estamos
all
expuestos a
behind
desarrollar esta
this sky,
enfermedad
or
también.
below the sky,
Por lo tanto,
basically. And we
sugiero
are all
reflexionar un
subject to
poco
this
sobre eso
disease,
para que
or
vean
we
que
are
todas
all
las
subject
acciones que
matters of
nosotros
getting it.
podemos ir tomando deben
And
seguir ese mismo camino.
I am trying to mention
Recordemos el
this
desafío.
because
¿De qué
all the
estamos
actions
hablando
should be
entonces
along
cuando
that line.
hablamos
What are we
de
talking
diabetes?
when we're talking
El
about
año
diabetes?
pasado, para el Día Mundial de la Diabetes del año
Last
pasado,
year,
la
for
OMS
Diabetes World Day,
lanzó las nuevas
uh,
estimaciones de
World
prevalencia de
the
diabetes en el mundo.
WHO
Y acá yo les
provided the
coloco
new guidelines
un
on
resumen,
prevalences
tan
of
solo un
diabetes in
resumen
the world.
que está
And this
de
is just a
acuerdo a las
summary according
regiones de la
to
OMS. Tenemos
regions
la
of
estimación mundial,
WHO. We have
región de
global
África, las
estimates, Africa
Américas,
region,
Sudamericas,
Americas,
Europa, etc.
Southeast
Y acá
Asia,
podemos
Europe,
ver que
and
tanto en
here
hombres
you
como
can
en
see that
mujeres, nuestra
men
región
and
no es la que
women,
está peor en términos
um,
de prevalencia,
our
pero
region is
sí
not
está
the
dentro de
worst
las tres
when it comes to
primeras,
prevalence,
lo
but
cual
we
eso
are
ya es
in the top
preocupante.
three. And
Si
that's
nosotros entramos y
why this
miramos
is
con más
concerning.
detalle
If
cómo ha
we
ido
start
aumentando la
going into the
prevalencia
detail
de la
how
diabetes en personas
prevalences
de
or prevalence
18
of
más
diabetes
años
have
en
been
nuestra región,
improving of
ustedes ven
people
acá en
older
el
than 18
círculo
years old,
rosado
you can see that
las
in the
mujeres y en el
pink
círculo de
circle
los
we
hombres.
have women, in
Podemos
the
ver claramente una
sky
tendencia que es
blue
casi
we
una
have
línea
men,
recta
and we can see
ascendente
a
con una
trend which is an ascending
ínfima,
trend
mínima
with
diferencia
a
entre
minimum
hombres y mujeres.
difference
Y si
between
nosotros
men and
calculamos
women.
cuál es
And
la
if we
diferencia entre la
calculate what could be
prevalencia
the
que se
difference
observó la
between
última del
prevalence
2022
of
y la estimada para el primer año de
2022
este
and
periodo,
the
que es
one estimated
de
for the first year of
1990,
such
nos
period,
damos
which is
cuenta que en los hombres
1990s, we
la
could see that
prevalencia de
for
diabetes ha
men,
aumentado
prevalence of
casi un
diabetes has
90%
increased
y en
almost
las
to
mujeres solo
90%,
80. Y si
and in
nosotros nos
women,
concentramos ahora en
over
el grupo de
80.
30 y
So
más
if we
años, que es el
focus
grupo
for
donde
the
suele
people that are older
presentarse
than
la
30 years
diabetes,
old, because
recuerde
this is
que
the group where
uno de los
people
factores
usually
de
get
riesgo de la
diabetes.
diabetes es
Remember that one of the factors of
precisamente la
risk
edad.
is actually
Acá ya el
age.
panorama se empieza a
So
poner un
the
poco más oscuro
scenario starts
y nos
getting a
encontramos
bit
que prácticamente el
worse, you could
17% de
say,
nuestra población
because
tiene diabetes.
17% of the
Y acá
diabetes worldwide
nuevamente
has or 70% of the population, worldwide has diabetes. And this is divided between men and women. The increase in this period has been ascending. And the problem is not having more prevalence, but the coverage of treatment has not been increasing with the same speed as the disease or the diagnosis. And the good news is that this has increased, but not enough. In 1990, for the case of men, they had access to treatment. They were receiving some treatment to control glucose in the bloodstream, and it was approximately 45%. Then it reached 57% for women, but men only 39%. If you notice, in the beginning of such period, there was a gap that was more determined between men and women. That means that women were able to access to treatment more than men. And this gap has been reduced because now the treatment is similar for both genders. But this is not something to be proud, because this is less than 60%. That means that there's a huge percentage of people that are not receiving treatment yet. So if we sum up all of this information, we could see that in our region, we have 112 million people living with diabetes. This figure, of course, is really high. Let's remember that between 40 and 80% of people, depending on the countries and areas, they don't know that they have the disease. So these 112 million people could easily turn into 160 million or even 200. In this age group, for the people that are older than 30, we have 105 million people, and coverage has been increasing, but I would like to highlight that at least we have 43 million people that are currently not receiving any treatment. So we have a problem. There's a large amount of people that are not receiving treatment. What's the impact? Because you have a high prevalence, and on the other side, you need to do something with this type of situation. We know that diabetes has characteristics of complications in a macrovascular point of view and microvascular side as well. But the main cause of death for people with diabetes would be cardiovascular disease, heart attacks to myocardium. We also have microvascular, like diabetic retinopathy or diabetic nephropathy. And these are other complications that I just listed here. These are only some, but there are more. So all of those 43 million people that are not currently having treatment, it is highly likely that they could have severe complications. It's huge that they could have this type of complications. And the health centers, they need to be liable for these people that are not receiving treatment. We need to strengthen the first care unit. And we're talking about the load of the disease. We're talking about the years of life divided per years of inability. And what do we have? For example, if we see worldwide, diabetes in 2021, and these are the last numbers that we received from PAHO, for WHO, sorry, it was the 8th cause of death. But in our region, it was number 6 in the ranking. But unfortunately, it was 15. But in our region, if you compare, we are in ranking 5. So that means that people are passing away in an early stage of their life. And also, you can see that years that they're living with this chronic disease, we are ranking number 4. So that means that they are living with disease in our region. And as a consequence of that, This is the third cost of years of life adjusted per disability. And ischemic disease represents second, ranks second, and COVID ranks first. So that's the only reason. And obviously, this is underrated, I will have to say. And the chart that I just included in blue to highlight this, I think this sums up the trend of disease load in a region. And I have highlighted the disabilities because the increase between both years when it comes to disability per diabetes is basically 50%. For example, years of life that we have lost prematurely, we know that the line is higher, but it is not as expansive as any sort of disability. So how are we going to face this challenge? We are certain that we have lots of challenges that we need to tackle. And how are we doing this? From PAHO, there is an initiative that we launched in 2023 to strengthen primary care attention to support non-communicable diseases. And I mentioned that this mass of people with some disabilities, with diabetes, they are going to be able to access the primary care level, and they need to be prepared to deal with it. What is the purpose of such initiative? To strengthen primary care services. And we need to provide an integrated attention for people that require it. And this implies, of course, to strengthen the information systems in a way to collect data to identify if what I'm doing is suitable or I need to do any sort of change. Now, these are the 6 strategic areas of our initiative of attention for non-communicable diseases. We have extension and expansion of services, community reach, etc. But this course that we're going to launch is oriented towards this 4th area, which is primary care attention. Like I have mentioned in our discussion, we need to be prepared when it comes to primary care services. There's no secondary level that could handle the amount of patients. We have a luxury of having a health primary care system that is good. And that's how we reach this course. This is oriented to diabetes mellitus type 2. It has a duration of 20 hours, and you're going to be able to access a PAHO certificate. What's the main objective? Improve the life of people with diabetes, but we want to strengthen technical capacity of first care health teams in diagnosis, treatment, and monitoring of type 2 diabetes patients by emphasizing an integrated or holistic management with other non-communicable diseases. And I would like to highlight that there should be an integrated or an integration plan. There was a whole trend of orienting our attention on towards a disease, but we forget that those diseases are a whole range of aspects that should be considered. Also, there's a possibility of obtaining 8 competences or skills, analyzing and describing epidemiological and ethiopathogenic fundaments or baselines, and we provide some knowledge on diabetes type 2, but this is related for basically for such type of diabetes. What we are expecting from you is that you're able to acknowledge the predominant clinical symptomatology, because in our region we have 40% or more of people that don't know about their disease, and we need to suspect that there is a clinical management. We need to be able to diagnose this in time. We need to be able to take clinical decisions. And the third competence includes applying the methods for diabetes, selecting the best ones for the patient. And if we have a diagnosis, we're going to need to develop a treatment plan that will be based on having multidisciplinary teams. Each one of the members of the team have a main role. It's not only resting on the nurses. The nurses have a big role, the nutritionist, the community workers, all of them have a role and responsibilities to comply with. And I would like to discuss the last competence. If we arrange the a multidisciplinary treatment, we need to apply an integral approach with therapeutic aspects based on evidence. We should not forget, and this is fundamental by the way, to manage the cardiovascular and renal risk of people with diabetes type 2. And this is the main cause of death, the main cause of disabilities, and that's why we need to manage this in the best way. We need to understand the principles of a scale approach with a pharmaceutical treatment. We need to design and implement an individualized and interdisciplinary therapeutical education plan, because we should not say to people what they need to do. We need a strategy. We need to integrate different knowledges. And I would like to mention in advance that within the first semester next year, we are going to launch a package to reinforce therapeutic treatment for people with diabetes. And the 8 competence is manage in an integral and timely manner the chronic effects. Who is this course for? Well, we are talking about doctors, nurses, nutritionists, social worker. We also are thinking about launching this for public officers of national programs for non-communicable diseases, or even students in university programs. So this is structured in 7 modules. We have an introductory module. This is linked to competences, general aspects of diabetes and integral management. What are the therapeutical aspects? What's the pharmaceutical treatment that we would like to recommend from PAHO by applying a public health approach? Non-pharmaceutical treatment, which is fundamental for people that have diabetes, basic knowledge focused on primary care for acknowledging and managing chronic diseases. How are we going to access this course? Well, you're going to go to the virtual classroom. You are going to click on the link, and in this tab of self-learning segment, you need to click the icon and you're going to see the first course. I'm hoping that this will be the most popular one, but we have the diabetes course. And if you click there, you are going to be directed towards the main website. And you're going to be able to hear or see a link of access to the course. You're going to be able to see the details. And I'm sure that you're going to be able to see the link here. And you are going to see the tab that says entry to the room. You're going to see that this is a structure in different stages of the course, and you're going to have a possibility to provide a questionnaire. So we are going to be able to share the knowledges that we have had. We're going to see how much of this knowledge we can apply. We're going to have a final assessment. It's going to help us to have a certificate of the course. I have included an image there, or what would be the example. This is signed by Dr. Yarbas Barbosa. He's the director from PAHO. What are the requirements to receive the certificate? Beyond having completed, we need to have a grade higher than 70%, and you need to complete the survey. And we have tried to tackle this with most of the topics, and within next months, we're going to be more educational material that we're going to use in the campus and our diabetes website in PAHO. I would like to mention that we also have self-care modules for diabetes that are oriented for people with the disease. One would be food care and people that would be interested in primary care assistance. And I would like to mention my regards. And without such initiatives, this course would not be ready. So this has been fundamental in our development. And
Un
thank
millón de
you.
gracias a ti, Carmen. Excelente presentación y muchas gracias por
Thank you so very much,
presentarnos
Carmen.
la
You made a
epidemiología del
brilliant
diabetes,
presentation,
¿no?
and thank you
Dado que
very
hay
much
un
in order to
aumento en la
address the
prevalencia, pero también en las
epidemiology of
personas
diabetes,
infectadas y la
highlighting
necesidad de
the
fortalecer la
scaling up
atención de salud, ¿no? Y gracias,
trend
mil
and the
gracias por
necessity of
este curso
strengthening the
virtual
health
de
system. Thank you so very
autoaprendizaje
much
para aumentar las
for
capacidades
putting
de
our
los equipos de
disposition such
atención primaria de
amazing
salud para
training in order to
fortalecer
improve the
el cuidado de
capabilities
personas
of the
con
health teams,
diabetes.
in order
Muchas
to
gracias.
strengthen
Y solo
their
quiero
knowledge in
notar
order
que
to
el
take
curso
care
está
of people
disponible
with
en
diabetes.
español,
Only
solo
to let you know
disponible
that
este
the
momento,
training is
pero
only
for our
available in
colleagues, our
Spanish for
English-speaking
now.
colleagues from English-speaking countries, and I see we have colleagues connected from Uganda. Thanks for joining us. We will have an English language version of this course on diabetes next year, so please stay tuned. It is our intention, but we can only work at one language at a time. So thank you again, Carmen, for an excellent review on diabetes and for launching this course. We continue with our program today, and we are really excited to share with you all the medicines and diagnostic technologies available through PAHO's revolving funds. And to present on this, I'd like to invite Chris Lim, who is the chief of the Strategic Fund at PAHO here. Chris, over to you.
Sure, thank you. Thanks, Savannah. Can you see my slides? Just confirm.
Yes, yes.
All right, great. So good morning, good afternoon, and good evening, colleagues, wherever you are. So my name is Christopher Lim, and I'm glad to have this opportunity to share with all of you about the Strategic Fund and the Revolving Fund collectively, right, on how we have been doing our collaborative work in terms of improving access to medicines, diagnostics, and health technologies for the region of the Americas. And as we have heard earlier on from Carmen, there is indeed a large population of people that are suffering from diabetes that either they do not know about their condition or they're not treated and in control of their situation. And that very much reflects a reality that I've actually recently encountered as well during my last mission to Mexico, where a clinical director actually told me, all right, we can train all the nurses and the doctors to screen more patients. But if medicines and test strips do not arrive on time, that trust in the system evaporates right away. All right. And today we are here to talk about how we can actually rebuild that trust, all right, especially in the supply chain of health technology for diabetes. And this is, in fact, why PAHO Strategic Fund exactly so-called exists, because we are here to help you turn fragmented procurement into a reliable access for everyone in the Americas that's suffering diabetes. Now, the Regional Revolving Fund consists of two funds, the Revolving Fund for Vaccines and the Strategic Fund for Public Health Supplies. And collectively, we have over 60 years of experience in terms of improving access to health technologies for the region. And just to reinstate the fact that we are created by the member states in the Americas, and we're not just procurement agencies, right? We provide technical corporations, which includes demand planning, demand consolidation, working with regulators, manufacturers, which eventually all this work culminating into procurement through an interprogrammatic team. Now, as you could see here, over the last biennium alone, we have supported the 42 countries and member states in our region, and also 27 public health agencies, right? Like the Social Security, and some countries, the army and the police force. And collectively, we have impacted over 180 million people in the region. And just to put things into perspective, that represents about 30% of the population within the Americas. And if you look at to the right side, you could see that more importantly, we have actually helped to save, 50 or upwards of 50% of costs in terms of selected vaccines and also certain therapeutics around HIV, right? But in short, this is what is really possible when we scale up pool procurement together with standardized requirements, and this is real value that can be generated and delivered. And this is exactly the same engine we can apply to diabetes and NCD care. Now, what are some of the comparative advantages of the Regional Revolving Fund? First off, we act as a regional front door, a consolidated single front door, which I'll elaborate a little bit more on how we have utilized some of the technologies that we have, like, for example, the new web-based platform that we call Member State Portal, that actually helps countries within the region to consolidate regional demand. Now, the next advantage that we have is that we help countries with predictable financing, and that is done through the line of credit, which is a 60 days interest-free loans that's made available to all our member states that's participating in the funds. And thirdly, we help with the end-to-end technical cooperation from planning of demand, to procurement, to quality assurance, and to nationalization of goods. And all this done with full transparency on quality and prices. Now, quality assurance is the bedrock to our program here, and it's the most important pillar, which is non-negotiable for us. So we leverage on WHO pre-qualified suppliers when it's available, but when it's not available, we rely on also suppliers that are registered in stringent regulatory authorities, which are also recognized by WHO, or one of the 8 PAHO regional regulatory of references, right, in our region. So all in all, this is to help to keep the access broad, right, but at the same time not compromising on any of the qualities. Now, this slide here shows how the Strategic Fund actually helps to tackle diabetes end to end. All right. So if you look to the left, starting from the left where we have quantification, and that's using a tool known as PAHO QuantMats, which we have developed, and that is helping countries to move away from guesswork in terms of demand forecasting into a more evidence-based, epidemiological-based, and morbidity-based forecast. All in all, to help reduce the possibility of stockouts, and more importantly, to give accurate demand signal to manufacturers. Now, the next pillar that we actually work on is around the diagnostics. We help to provide and have access to quality assured glucometers, HbA1c test kits with standardized specifications. Now, together with bundled strips and also controls, and ensuring that there is interoperability so that data can be fed into national registries and also at the same time to dashboards that helps monitoring itself. Now, from a treatment perspective, we help to consolidate volumes of medicines, which include essential oral medicines like metformin, glycosides, and also insulin. And in cases where it's clinically essential and appropriate, and where it's cost effective, we provide the SGLT2 inhibitors like dapagliflozin and empagliflozin. Right, and all these are done through transparent price and volume arrangements. And finally, moving to supportive equipment, which we also provide, and that includes ECG machines, portable vital vital monitoring devices. And what's important is for all these different equipments, we put them into a single package, which includes installation, calibration, training, maintenance, and so on and so forth. And all this with the hope to reduce the total cost of ownership. And again, this is another clear indication of how we can, through a single coherent pathway, help countries move from forecasting to access so that countries can actually scale up their diabetes care, right? Reducing costs, improving control at the primary healthcare level. Now, over here, you could see if you were to use the QR code, you would actually go into a website that shows what are the list of product catalogs that's available through the Strategic Fund. And if you were to navigate into the Better Care for NCD and under the priority area of diabetes, you will see all the different products that's available through the funds. And likewise, you can navigate that for any other therapeutic areas. Right. So as I said earlier on, we do provide medicines end-to-end integrated pathway, right, of health technologies ranging from preventive, right, prevention like vaccines, to diagnostics, to treatment, and also to supportive equipments. And all these are made available through the NCD Better Care bundle. And it helps with the control of HPV, cancer, diabetes, hypertension, and also COPDs. Now, this is an interesting slide, right? I hope it helps to tell a very simple but powerful story, right? Where when there is negotiation and pooled procurement, it actually comes together to help to change the trajectory of history. As you could see here, metformin has actually got a reduction of 85% in terms of price, and likewise for glycoside, almost 75%. And all this is really done through just consolidating the demand of 3 to 5 different countries over the last 4 years. So this is a clear demonstration, right, that when we aggregate demand and when we standardize the specifications, countries stop paying what we call lonely prices, right? Very disparate and also disaggregated prices into paying a single fair regional price. All right. So again, this is another demonstration of power of consolidation. Right. Looking at it from a different angle, right? This is where it shows we're trying to show that there is a huge disparity of prices across the regions within the different countries around our region, right? Those bars that's painted in orange, it shows exactly the same molecule that can sometimes cost upwards of 12 times compared to the standard price that we have through the Strategic Fund, right? For example, for tamsulosin, the fixed dose combination of tamsulosin and amlodipine at 10 cents and glycoside at just 5 cents. You can see the vast differences and, of course, the big variation between countries paying exactly for the same molecule. So this is opportunity for cost savings and is enormous. Now, from a comprehensive package standpoint, as I mentioned earlier on, the funds is not just a procurement unit. We provide through an interprogrammatic manner, right, technical cooperation. And starting from, if you look at the top left-hand corner, we start out by helping countries working with our IMT colleagues with the selection, rational selection and usage of medicines, and ensuring that all this medicine that's available through the funds are aligned to the clinical guidelines and the benefit packages of your country. Next, we move on to quantification utilizing tools like PAHO QuantMats, and also then moving on into the more logistical procurement part of the access strategy. We help you with the procurement, the supply management, the logistical and the shipping end to end, and in fact, even including post-delivery monitoring and stock performances. So in short, we're not just buying for you. We're helping you to plan and also at the same time monitor the entire pharma value chain. Now, you've heard a lot by now about this PAHO format, and in fact, it is an in-house developed tool by PAHO, right? And it started off with us just using it for communicable disease like HIV, malaria, and leishmaniasis, right? Just to name a few. But we have then moved, and we've seen the successes, and we then move it into the NCD space, right? Like pediatric oncology, cardiovascular, and now in diabetes. And it is with the help of this to convert epidemiological data together with treatment protocol assumptions into accurate demand forecasts, all right? So that we are moving away from guesswork or relying on historical trends, all right, of procurement trends, but more into a reality-based, evidence-based forecast. Now, specifically for diabetes care health technology, what are some of the barriers that we observe? These are the few of them. Right. First of all, there are very few qualified international manufacturers, and over 90% of the world's market is actually capitalized by just 3 big pharma companies, and it makes negotiation very limited and difficult. And the next difficulty and challenges we've seen is that many countries, they do not make timely updates in terms of the national treatment guidelines and the national formularies, despite the fact that there are recommendations from WHO, and also all this resulting in a tardiness in terms of updating their national formularies, and that leaves countries and patients paying high out-of-pocket expenditures. Now, beyond that, we also observe that there is a lot of fragmentation and segmentation of procurement between institutions, sometimes even within countries itself, whereby individual hospitals are buying that small little quantity. And all this result in the huge price disparity that we saw earlier on in the earlier slide. And of course, the other challenge that we've seen is that countries typically do not have a good methodology in terms of forecasting, in terms of giving demand visibility, right? And therefore, what have we done from PAHO's perspective to help with this solutioning? So first and foremost, we help to strengthen, right, the forecasting capabilities, as you have seen through the PAHO QuantMet methodology that we have built. And then the next thing is that we have also used new technologies like our member state portal that is aligned to the annual demand consolidation process that we conduct with countries on an annual basis to consolidate the demand across countries and institutions within our region. So all in all this helps together with interprogrammatic technical advisory that we provide collectively as an integrated team with NCD, with IMT itself, right? To make sure that guidelines, essential medicines lists, and also benefit packages are moving in a congruent and synchronized manner. So the last piece here I want to just elaborate a little bit on is on the supply chain strengthening piece, right? On how we ensure products reach patients and not just the shelves, right? So the first thing that we help is with characterization and providing a baseline assessment of a country's maturity level from a supply chain perspective, all right? And that looks into elements like governance, quantification, procurement, last mile delivery, and so on and so forth. And all this is to provide an initial heat map for a country to serve as a baseline. And then at the same time, after that, we will work with them for a prioritized 12 to 18 months improvement plan. So other things that we help is to conduct regional workshops, right, whereby peer-to-peer country learnings, whereby they share best practices around things like warehouse layouts, last mile delivery, and so that we can actually turn success stories into standardized playbooks that countries can learn from each other and adopt quickly. And of course, we utilize and continue to promote quantification methodologies, as you have heard earlier on, and also at the same time conducting GSDP, or good distribution and storage practices, so that we help countries to actually convert and translate WHO guidance into practice. So all in all, this will then help in terms of the availability of supply chain resilient within countries. Now, in closing, I'll just say that now in the Americas, we've seen and proven that a simple idea works, but it creates massive impact. And that is by buying together, we are saving costs together, and we deliver results together. And we are moving away from the fragmented procurement into a reliable single supply line. Why is this important? Because any interruption in terms of medicines, in terms of test strips, it actually keeps a parent away from their work and it keeps children away from school, right? Simple as that. So the last message I would just want to pass on, and hopefully you can take away, is that together with the Strategic Fund, we can turn diabetes care from a budget-constrained situation into a managed care through achieving 4 A's. So let me reiterate what are the 4 A's. First is the assurance of quality. We ensure that quality is ensured for all the products that we deliver with the countries. The second A is affordability. That affordability can be achieved and improved through procurement and also economy of scale. The third A, availability. Availability can be increased through strengthening of supply chain systems, which we help with. And the last A is all this increases the accessibility, right, or to the health technologies that's available in a timely manner, and also together with the technical assistance that we help with of updating guidelines, policies, and practices. So again, all in all, achieving 4 A's is possible by working with PAHO and the Strategic Fund. So with that, I'll pass the time back to you, Savannah, and thanks for the
Excellent.
opportunity.
Wonderful. Thank you so much, Chris Lim from the PAHO Strategic Fund. And what an extraordinary range of products that are available for diabetes medicines and technologies, but not just the products, but also, as you described, Chris, the QuantMed as a resource for helping planning, the supply chain strengthening, cooperation that we work on together with countries to ensure that there's quality, affordability, and availability. And really, the true test is in that reduction and those extraordinary price reductions that you showed in your presentation of the power of consolidation, right? Creating that that more available, accessible availability of essential diabetes medicine. So thank you again, Chris, for work in the Strategic Fund and for partnering with us in the NCD program on diabetes. Thanks.
Lovely. Thank you.
Great. Ahora seguimos con la presentación.
Now we continue with our presentations, and now is the turn of an experience of a country of our region, the country of Panama. And for this, I would like to invite Dr. Gisela Ibarra from the Program for Adults of the Health Ministry of Panama to address how Panama is improving the care of people with diabetes at the primary level of attention. You are welcome, Gisela. The floor is yours. Thank you very much, Silvana. Good morning to all of you. For me, it's a great pleasure and honor being here with you into this webinar in the frame of the Diabetes World Day. I am Gisela Ibarra. I am a technical professional physician from the Program of Adult Health from the Ministry of Health of Panama. Very simply, I want to show you how my country has robust and improve our strategy while doing small actions. As Carmen said, our strategy needs to start always from the primary level of health services, as we did. Next, please. Next slide, please.
No.
I'm sorry, so someone can help me with the slides, please. Let's see what is going on. One moment, please. We'll be back shortly. Yes, we're back. So what was the challenge? The diabetes in Panama is not a secret that this disease is one of the main challenges of public health for all our region. In Panama, it has the prevalence that was measured in 2019 of 14.4%. This mandate for not stop to being reactive because we acknowledge that this battle cannot be won from a second or third level of the hospital, but from the community. The unique sustainable answer against this disease is a robust approach that will put our APS as the center of the national strategy for health. So our strategy is based on two fundamental pillars. As I mentioned before, the APs as the main X, as the entrance door, the base of prevention for the first time prevention, capturing and management of the diabetes. APS stands for the primary health attention. And the second pillar was the collaboration because our assessors highlighted the fundamental way that we were working. So in the last 3 years, our savings bank and the health ministry has started working together as an example of great cooperation and coordination as a pilot deployed at Chiriquí province, which is related to the integral service for care and treatment of diabetes. So both institutions had united efforts in order to carry out this project that is first deployed in this Chiquiri province. How we passed from the strategy into action while standardizing, investing on a solid regulatory framework. We had issued the integral guidelines for people that suffers with diabetes done between the health ministry, the savings bank, under the consultancy of PAHO that ensures to deploy the same standardized care system into all the nation. Also, with the support of the PAHO office, we issue and implement the clinic guide for the management of people with type 2 diabetes aligned with the Hearts D initiative. This is not a simple protocol. This is a step-by-step operational in order to optimize the patient flow inside our health facilities. Something else very important is the legal framework. It's key. And it was done through the law 136 of 2020 that established public policies for the control of diabetes, which give us the political backup that we needed as a country in order to shape the different strategies. In addition, the technical administrative normative for the health problem for adults and elders from 2018 that is currently on ongoing updated will provide an operational command for the application of the PAHO standards. So this framework is get translated in key actions framed in the filtering, diagnosis, or the analysis, the diagnosis, and active capture. Through our analysis done in a proper, timely way, we approach the community with health days as part of the health programs that we carry along with the primary health services attention, the primary level, directed to adults and elders. And then with the standardized diagnosis, we have criteria basing glucemia, well, and also an active attraction with different activities. So once the patients get into our system, we carry out an integral treatment, emphasizing the non-pharmacological treatment in order to empower the patient, her family, provide them with education and support them about food and physical activity aspects. This is not mentioned, but it is important to say that our country has developed an accelerated plan in order to stop obesity. This is linked to the legal framework that I mentioned, because this is the main risk factor for the development of diabetes. The burden of our population is more than 50%. They suffer of being overweight, of being obesity. So we had adapt the WHO guidelines for physical activity, and we have made some further steps in this matter. Also, we are carrying out the guidelines for the prescription of exercise with the focus on people with diabetes mellitus, everything from the first level of attention that also strengthen this from the risk factors point of view in order to avoid the development of the disease or avoiding complications. In second place, we have the pharmacological treatment, as well as the country has been looking to ensure the availability of metformin and insulin. We have made a big leap because our current guidelines also include the ISGLT2 inhibitors on the first level of attention for patients that had comorbidities that are cardiovascular or kidney. I have mentioned a little bit about the pilot project that we are deploying at Chiriquí, integrating the care of diabetes, but I would like to take just a few minutes to talk about this, because this will become the lab of our implementation that we would like to deploy at national level. This project is looking to integrate the management and strengthen the management of what was done for the diabetes in the OPS environment, of the WHO environment. So we want to strengthen the services in order to empower the patient, for him to take a better self-care and taking well-informed decisions. We have the critical approach of the intergenerational approach in order to provide education also for women in order to have healthy pregnancies. So this pilot program in Chiriquí will be key for the deployment at national level. About the innovation aspect, we are approaching this while utilizing telemedicine. The Panamanian geography is a challenge, as for many countries of our region. So for here, technology plays a key role. So once we had implemented the telemedicine program in 2021 that we were forced to, because this was one of the few positive things that COVID brought to us, which is related with the implementation of telemedicine programs in order to do follow-up to chronic patients. This was an initiative of the Health Ministry, which had helped to improve the adherence, reducing the geographical gap, and improve care for those patients that are located very far away and that they don't have access to health services. So this is an example of how we had adapted our attentions into our population's need. Next example, I would like to highlight again one of the main strengths that we had developed in the latest 3 years, which is the achievement of the collaborative work between the Health Ministry and the Savings Bank for Social Security, which currently have managed pretty much 32 diabetes clinics at first level of attention in the whole territory, national territory, that provides integral care for patients and education. I'm sorry. Integrating all the professionals that are related with the management of diabetes patients. Our effort is not it's for duplicating, but it is for better coordinated. The pilot program in Chiquidi wants to guarantee that despite if the fact that the patient is being served by a hospital of a savings bank public health, all the attention is being based on the protocols that we had issued together in a coordinated manner. So if you want to take a key message about the change of the approach that we are applying in Panama, is that we have switched the paradigm. paradigm. Our objective is not only to ask someone to change the design, but now we also are participating in the management of the kidneys and cardiovascular risks. This includes in our guidelines. The patient of diabetes number 2 is the heart of our guidelines because we are applying a vision of a chronic patient that requires an intensive treatment and service in order to avoid any complications. Our strategy has been the result of a constant evolution. Maybe it didn't have the pace that we wish to have, but step by step, we're moving forward. Here a little bit of our timeline. In 2014, we were able of through our Department of Non-Transmittable Disease to design our strategical framework for the management of risk patients, where we prioritize the strategy for diabetes. After this, in 2018, Panama adds up to the heart strategy of the Americas. In 2020, we received the legal support required through the Law 136 in order to the control and treat the diabetes in the country. In 2023, we published our updated guideline focus on the approach on the life of the patient. The latest version was for 2019. And after we issued the clinical guide for the management of diabetes type 2, we started implementing it immediately. In addition, we started the pilot program in Chiriquí, and in the future, we want to ensure the scaling up through the national training with online courses at national level that we are also organizing with the support of the PAHO that is providing us of a space in order to create it at the nation nodes of the platform of the virtual campus. As you know, we need to be clear and transparent and do very transparent math and not everything is positive. There are also other things that we had to fix. Along the way, we have many achievements, but at the same way, many other challenges. As part of the achievements, I'm highlighting the inclusion of the inhibitors ISGLT2 with a solid, then we have a very robust legal framework through the Law 136 and the standardization of the diagnosis of the diabetes patients. But as many other countries of the region, we need to close the gap on the information systems in order to take decisions based on data of quality. We also need to ensure a continuous availability and procurement of this new medicine that we are including for the treatment of our patients. And of course, guarantee that the success that the integration projects of diabetes in APAS at Chiriquiri to be replicable in the rest of the provinces of our country. Next. So in order to wrap up, I want to repeat our commitment because Panama is making baby steps in order to build a model for primary attention that is integral, focus on the person. We are moving forward into a health system that put the patient at the center of his or her care from the first level of attention. So thank you so very much for your kind attention, and thank you for the space that the PAHO organization had provided to us in order to exchange some information. I would love to talk in more depth this, but thank you for the space in order to share our experience as a country. Thank you very much, Dr. Isela Ibarra, for your leadership and commitment in Panama, working from the health ministry, but very close with the Savings Bank of Public Services in order to improve the management of people with diabetes, with continuity, with an integral approach, with education, and all the way related with the prevention of complications. Thank you so very much for that. So, with this, we're closing our webinar for celebrating the World Day of Diabetes. And our session had getting to the end. I hope that you leave with new information about all the resources that we have available through the PAHO, about the new course for learning, and the new medicines and technologies provided by the strategical funds, and much, and all the resources that we didn't have the time to show you about nutrition, obesity, physical activities that also played a very important role in the management of people with diabetes. So we hope that we had motivated you enough in order for you to use all the resources that we have. I'm so sorry, I apologize. That we have available from PAHO in order to improve the scopes of your work. And tomorrow, that is the main day for the diabetes, we will launch a new guidelines for diabetes for pregnant women about the clinical management of pregnant people, type 1, type 2, or stationary diabetes. So please follow up our social media of PAHO, visit our website in order to access to the new resources that we are launching in order to celebrate the World Day of Diabetes. Thank you very much. And continue participating. Thank you very much. See